Hello, everyone. It's Dr. Jensen from Dean's Chat. If you're on the fence as to whether you want to join the American Podiatric Medical Association, jump on in. It's a new APMA. Whether it's advocacy concerns, scope of practice, billing and coding, consider membership at the APMA as your professional insurance. Hello, everyone. Welcome back to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the co-host for the Dean's Chat podcast. Once again, I am with my co-host, Dr. Joanna Richey. Hi, Joe.
Hey, Jeff. How you doing?
I am doing fabulous. Life is good, and everything's great at the college. Our third years are off on rotation. Just an incredible time of year.
It is. It's always fun to hear their reflections that they've started back into rotations, and also hearing back from some of our fourth years that have been on their clerkships and kind of what those experiences have been like. It's a really fun phase of life or phase of the year right now. So.
Absolutely. Well, Joe, we have a phenomenal interview today. We're joined by students from Kent State University College of Podiatric Medicine, and they all have had experience with the American Podiatric Medical Students Association. And that's the last time I'm going to say that. I'm going to call it APMSA from here on out. But I'd like to introduce our guests. Representing the class of 2027, Madison Darnell. Madison, welcome to Dean's Chat.
Thank you. It's great to be here.
Thank you. Also representing the class of 2027, Pooja Patel. Pooja, welcome to Dean's Chat.
Thank you. Thank you for having us.
You're welcome. And representing the class of 2028, Mira Adelstein. Mira, welcome to Dean's Chat.
Hi, thank you so much for having us.
You are very welcome.
Yeah, we are so excited to have you guys here. We love hearing from the students what your experiences and your perspectives are. I'm sure each of you remember what it was like being a student in this transition of trying to figure out, what do I want to do with my life? What is this podiatry thing that I've heard about? So we would love to hear a little bit from each of you about your undergraduate experience, what your degree was in, and then how did you find out about podiatry? Madison, we'll start with you because you're the first one in my screen.
Yeah, of course. So I went to a small private college in Kentucky called Georgetown College. I found out about podiatry because my uncle was actually a podiatrist. So I've kind of always had an idea of what it was. So I've gotten to see what he does. I've also I played basketball like all my life and through college. So I've seen a lot of foot and ankle injuries, and he's actually kind of treated me firsthand whenever I've had a few ankle sprains or so. So I've seen it firsthand what he does. I've also got to shadow him a bit, and I've seen some injuries in like my college time as well. There was actually a time where a girl broke her leg right in front of me, and I thought it was on me because we both went after a ball, and she broke her ankle, and I thought it was me, and I cried that day. That's not why. And that wasn't the moment that I decided I wanted to go into podiatry, though. But it did give me some insight of the types of injuries that we deal with, and got me more excited. So after talking to my uncle more and some other podiatrists, it's kind of how I chose.
Oh, I love that story. And the skills that our student athletes bring to the table when it comes to their educational experience, I think are really invaluable. So we'll dive into that maybe later. We'll see how the conversation goes. Pooja, how about you? Can you tell us about your undergrad, what your degree was in, and how you found out about podiatry?
Yeah, of course. So I'm from Florida. I did my undergrad at Florida International University in Miami. I majored in biology and natural sciences, and I graduated from the honors college. So there we would always have, with our pre-health, our pre-health counselors and stuff, they would always tell us about different like schools, different professions that you can go into with your biology degree, on your pre-health track or your pre-med track as well. And I had a friend who was doing her master's at Barry, because Barry was really close to us. So she's like, hey, maybe check out podiatry. And I was like, okay, great. Never heard of it. Didn't know what it was. The more I learned about it, the more I realized how relevant it is. I, just like Madison, I was also an athlete, so I suffered from a lot of injuries. Surprisingly, I got more injuries after I found out about podiatry. I was like, oh, great. But after I found out about podiatry, I got to shadow some podiatrists in Florida. I got to work at the local hospital, and I became an MA for a podiatrist. And that's where I really learned more about the field, how we can better help people, different career paths that you can take as a foot and ankle surgeon, going to surgery, private practice, fellowship, research, and just fell in love with the field. And here I am today.
Oh, I love that story. And certainly having a clinical experience in the field it'll be fun for you to go back in your clinical rotations and see it from a completely different perspective and lens. So I think that's really a special opportunity for students that come in with that clinical experience, both pre and post the didactic part of class. So Mira, how about you?
So I went to the University of Wisconsin in Madison and studied neurobiology there. And I have kind of known about podiatry my entire life because my father is a podiatrist. But I really wasn't interested in podiatry at all until I think it was my junior year of college. I had my certified nursing assistant license because I thought I wanted to go into PA and go to PA school. So I was able to help him one summer when I was home in his practice as an MA. And that was really just to like fill in for an empty spot and to pick up some extra shifts, get some more experience. And then working there that summer, I just realized that it was basically everything I'd been looking for my entire life. But I think it was just a little too close to home. So I had never really considered it. And then once I saw like all the amazing things and the types of people you get to treat and the relationships you build with them, I was very confident by the end of that summer that that's where I was going to go.
Oh, I love that story too. It's, having, legacy experiences in podiatry, you also can appreciate having someone that you can trust in terms of their perspective. If this was not something that your dad thought you should get into, he'd be pretty honest in telling you that. And so having that support structure, what an amazing experience. And I'm sure he is just thrilled to see the things that he's passionate about carried out with you, and a whole different level of legacy, right, Jeff?
Absolutely.
Or Dr. Jensen.
No worries. Mira, where does your father practice?
He practices outside of Chicago at St. Alexian Brothers Hospital in Hoffman Estates.
Very good. Now, the reason I ask is my wife and I met in Madison in college. So we
Oh,
were
nice.
not sure if he was from the Wisconsin area, but it's close.
All these 7 degrees of separation. Look at that, right?
Truly amazing.
Yeah.
And just from our audience perspective, before we started the podcast, Mira was sharing with me that her father did the same residency program I did. So it is a small world out there. That's for sure. All right. Well, hey, let's move on to the next question we have for you. What did you find out when you got into podiatry school that you weren't expecting? Kind of a surprise with the curriculum or something in the profession. Pooja, let's start with you on this one.
Something that was very interesting was how we're not just learning about the lower extremity and the foot and ankle per se. You're learning about from head to toe. You're learning everything. I think that was really major because I actually didn't know what I was expecting getting into it, but that was like, wow, like, because I would share curriculum, like our academic stuff with some of my friends from like other schools or other professions. And I'd be like, hey, we're learning the same thing. We're on the same like neuro block, or we're both learning about like dermatology today. Like, so that was really cool. And then being able to like apply all that now in rotations is kind of like, it kind of clicks. It's like, oh, wow, like really cool. And then cadaver labs. I don't know why it just, until I got here, it just didn't like, it didn't sink. And then now it's like one of my favorite things to do, but yeah, that was pretty unexpected too.
Very good. Mira, what surprised you or was unexpected when you came into podiatry school?
I think just because I grew up around podiatry my whole life, I was really surprised to find how many people don't really have a great understanding of what podiatrists do and the field itself. So that kind of surprised me just because I think my bubble was, and all the people around me my whole life were all so aware of what podiatry was. So coming to Cleveland in a new place and meeting a lot of new people, that really kind of surprised me. I know that's not directly related to school, but just kind of in that transition.
That's a good point, because it is kind of a shock because we all live in our bubbles. But
Right.
it's not surprising that the two of the three of you have family members that are podiatrists, and then you've been treated by podiatrists. And a lot of times that's some of the commonalities we see in students, because what you don't know, you can't see, right? So if I think Joe and I find it when we do our student recruitment visits at colleges, sometimes we have to, it's not about recruiting them to our school, it's about recruiting them to our profession and defining what podiatry is first. So that is a challenge and something that the profession needs to address also on a larger scale. So Madison, when you got to Kent State, what is something that surprised you about the curriculum or something you didn't know?
I'll say I love this question because I was just talking to someone about it. Like the surprise of like being in the field versus kind of like what you expect going into it. And my biggest one is just like the complete like diversity of it all. Like the amount that you see and like the amount that we as podiatrists like treat. Because going into it, I mean, you hear about podiatry and everyone hears like calluses, bunions, nails, like maybe an injection, sports injuries, something like that. But like I've always seen it more from like the clinical side. Now like learning more about podiatry into like third year, more about the like the podiatric like, conditions and like congenital things like sports injuries, you see surgical just trauma, like diabetic, like wound care, like the amount that you see and like the experiences you get and like I love like going home and telling my siblings, like I have 4 other siblings and like I go home and I show them x-rays and I like show them all about these different conditions and they're like they love to hear about it because they're like, I had no clue that this is like what you guys do. I've never heard about this either. So that was like my biggest surprise. And like, that's what I've loved the most of that. I've kind of fell in love with the profession even more being in it than what I expected going into it. So thank you for that question. It was really cool.
That is interesting. Joe, I'm going to answer the question, same question on my end. It blew my mind when I was a student that patients didn't have feeling in their feet. Secondary diabetes or other. It just, I'm like, really? Because I went into it for sports medicine and surgery, and I had no idea there were different systemic diseases that affected the lower extremity. It's just, I had no idea when I went into it. So we always have those aha moments. I don't know if you had any of those, Joe.
Yeah, so this is so fun. We haven't even talked about like you and I even just as sidebar conversations haven't talked about these questions. The neuropathy thing totally blew my mind as well. I remember distinctly, that was not at all why I had originally gotten into podiatry or started to investigate it. But that was one of the big hooks when I'm like, how can someone be at risk of losing their leg just because they have this history of diabetes? I know so many people that have diabetes and they all have legs. Like, again, the small little worldviews that my 21-year-old version of myself had, right? And learning not only how devastating that can be because you don't get that warning sign, but then seeing these complications as a side effect of that neuropathy was the thing that I kept like, I want to know more. I want to know more about how to help people. I want to know more about how do I prevent these things? How do I be a part of the solution? And I would definitely mirror the neuropathy being like, what do you mean they walked in with a nail in their foot? How did they not know that it was in their foot? So to kind of piggyback on that, actually, I might jump some questions here.
Sure.
I think this would be a really fun time to get some inspiration stories from each of you. It's so fun to hear about the things that surprised you or the things that have been, learning experiences as you've gone through this process. I'd love to hear about an experience that really inspired you. Can you talk about either something recent or in the past and kind of how it's impacting what you're excited about? Mira, we're going to start with you this time.
So the first thing that comes to mind when I hear that is actually something that I saw, like a patient that I saw when I was an MA at my dad's clinic. So in my undergrad years, but it still has stuck with me. So that's how impactful it was. But it was a patient that was coming in, I think it was once or twice a week for wound care. And he really had like a horrible, horrible ulcer on his heel. And it was down to his bone when I started seeing him that summer. And by the time and every week we would get to know each other a little bit more, and he'd bring in a different grandchild of his, and they'd be on his lap in the wheelchair coming into the office. And I would always see him on the schedule and get really excited just because we just had a really great relationship. And then each week it was getting better and better, and there was different graphs being used, and it was just really cool to see the type of technology and the troubleshooting through his condition. And just like watching all of the doctors that were working with him just not give up and have a lot of backup plans for how they could hopefully get him back on his feet. And actually my last day working before I went back to school for the end of the summer, he was able to like fully walk again at that point, and was completely healed. So it had been a really, really long process, and it was by no means like completely healed, but he was at the point where he was able to stand again and play with his grandkids, and to just see how emotional it made him and his wife, for giving them that ability to kind of go live again. It was just like the most incredible thing. I like remember walking out of the room and like going into the restroom to like kind of cry, just because I was like, this is incredible and just so special to be a part of. So that's kind of, I think, one of those moments that I was like, this is definitely what I want to do.
What a beautiful story. That impact of giving people back something as simple as ambulation. And they're the little things that we sometimes take for granted, but that has big impact on our patients' lives, and being able to share in that. That's a really beautiful story. Pooja, how about you? What was something that's inspired you?
When I was, something I can recall back to is when I was preparing for interviews and for podiatry school, and I was just Googling questions and just interview prep, why podiatry, and I was looking at everyone else's responses, and something that I kept seeing was helping patients with instant pain relief. They come into your office and they're in pain, and when they walk out your office, they feel better. And I couldn't grasp that concept of how can because I've never seen that. Every time I go to a doctor's office, it's always for something chronic, something long-term, something really devastating. And so I was like, how is a patient leaving my office feeling instantly better in 30 minutes? And I did not understand that until this year, when I started going into like our school clinics, and patients would come in and they'd be like, my nails are really bothering me. And all it is just simple diabetic foot care for them, and just helping them with their nails, helping them with their calluses, just talking to them. And once they're leaving, they're like, I feel great. I feel so much better. And I'm like, that's like it kind of makes you feel like, oh my God, like I'm actually helping my patients. And then you get to see like, oh, like this is what everyone was talking about when they said that you can actually see the difference that you make in your patient's life on a day-to-day basis. And so that's something that I'm really grateful for right now.
Oh, I can definitely mirror that. And it's always fun, right? When you hear about other people's experiences, and it's hard to put yourself in like, what do they mean? I don't understand how that could be a thing that you would see or witness or experience. And then you get to have those connection moments. You're like, oh, this is what everyone was talking about.
Mm-hmm.
I understand. And you can see why we make the joke that podiatrists are the happiest doctors in the hospital.
Mm-hmm.
These moments of impact that you talked about, Mira, and these connections, Pooja, where we instantly help people, that is gratifying for us as much as it is for our patients. And Pooja, you pointed out really astutely, not every healthcare field gets that kind of positive reinforcement. So when you factor in all the things that people talk about medical care and the system and what is contributing to burnout, this is why we are the happiest doctors in the hospital. We have these opportunities for repetitive times of positive reinforcement and impaction that we're making on patients' lives. And I love hearing your guys' different experiences with that. Madison, how about you? What's something that's inspired you?
So mine's like a little bit different, like on a different front, because I wasn't as inspired kind of before going into podiatry, but like once I got into school, I was more inspired to be on like more of kind of like the legislative side, and like it kind of blends in with my story of getting into the APMSA. Because I remember like being in orientation as a first year, and I was like nervous. I was kind of like just watching, waiting, trying to make some friends. And then like during orientation, like the student president-elect, student vice president-elect Jamie Stahl at the time. She came in and she was like dressed real nice and gave this great presentation on like all the clubs and everything. And that's like a moment where you're like, oh, like this is like what like put together looks like. This is like how I want to be. This is what I want to do. And it's like a moment of inspiration. And then so I kind of like reached out to her and like talked about it and was excited. But then I kind of talked myself out of it. I was like, I wanted to be like that. But the problem was I was shy. I was shy and I didn't have a lot of like leadership experience. And to give a speech terrified me at the time. I'm not even gonna lie. I wish I could say that I was ready and like knew what I was doing and getting into it, but like I wasn't. And so I almost talked myself out of it and like almost didn't even apply to run for president. And she talked me into it, like the reasons why I should. And so kind of because of her, it like started up like a bunch of confidence, and it got me into seeing this side of like podiatry and like the advocacy and like the impact that we have outside of just the school. Because in the first year, you're kind of focused on grades and stuff, but you see everything out of it. Like you get to go to these conferences and see the reps and meet all these new people and these new doctors and everything. And so now, like because of her stepping forward, it has like inspired me in the profession and give me a much deeper respect for everything we do, just because I've gotten to see so much and be so a part of it.
Oh, I love that. And it's incredible seeing someone mirror or demonstrate what you don't even realize you want, but you see it and you're like, I want to be like her. I see how I want to be. And I commend you on the courage part, because it is scary to put yourself out there. It is hard. And each one of you work really hard at just doing basic student things, let alone adding in all of these extra leadership opportunities. And Jeff, it's almost like we gave them the list of questions. They don't have them for the audience, but this was a beautiful setup for where we're going with the interview. So without further ado, I'm going to hand the ball back to Dr. Jensen.
Thank you, Joe. That was a great segue to your point. Something I wanted to comment, though, when you first show up at school and then you're getting inundated with all this information about different clubs you can be involved with and all these extracurricular things. And in the back of your mind as a first-year student, there's free-floating anxiety about the medical school curriculum. So it's reasonable to have doubts or not wanting to dive in head first. But with that in mind, all three of you have become student leaders at Kent State. All three of you are or have been part of the APMSA, which we talked about earlier. And so maybe we'll just piggyback right there. Madison, you already said, you ran for president. Can you talk about some of the things that you do in your APMSA role at Kent State?
Yeah, so at Kent, it's kind of like our student government. It's called like Ohio Podiatric Medical Student Association, so it's OPMSA. And we're in charge of hosting we have a few large events that we kind of host. We have like a club carnival at the beginning of the year. We have our annual symposium, which is kind of one of our biggest events where we have lecturers come in and we work to have like a raffle and we raise money to give to a charity that we work with the whole year. So that's like our big event. We have a few others, but kind of like our role being as the president, we're basically kind of like this vote for Kent State on the national level at APMSA at our House of Delegates meeting every year. It's a meeting at our national conference. And so that's kind of our link into like the APMSA, and also being the president. I'm also part of the president's committee, where it's basically all the presidents from every school getting together and we kind of discuss like what we're going to do as an event at the next national conference and how we can make it better for everyone, as well as kind of doing some scholarships and awards and stuff like that. So
very nice. Pooja, you had commented earlier that you're no longer with OPMSA or APMSA, whatever the connection is there. I'm sorry. But some of these positions are there for a year, then you rotate off. Can you talk about your experience and how you got involved and the impact that perhaps it made on you and how it helped your classmates?
So I had a similar experience to Madison, where I saw one of our one of our like peer mentors from the second year, third year class, and they were in this APMSA delegate role. They were in OPMSA, and I was like, wow, like I want to do what they do. Like I want to, because they were advocating for students. They were advocating for resources. They were really being a voice for students between Kent State and like nationally. And that is something that I hold very dear to myself. I love advocating for students. I love advocating for just those around me. And I wanted to get more involved in that. So I joined APMSA, and I also was in OPMSA for like a year. It was like a connection. I don't know how to explain it. And with the roles, it was just keeping students informed, keeping students engaged, and letting them know what there is after Kent State, after your 4 years of school. What do you do after? How you can be involved in like during residency years, how you can be involved after residency. And I just love keeping like students excited. I think a lot of it is just students knowing what there is after you graduate, after residency, keeps you a little bit more motivated to continue on. And a lot of students, they'll see different roles and opportunities, whether they can be involved in legislation, whether they can be involved on the national level, on the state level, even just like a local level at the school or within the community. I think that's really big. So that was something that I got to do with my role. And even though I've like transitioned out, I still keep up with like APMSA, APMA, and it's very exciting.
Very good. Well, thank you. Yeah, it's so funny because students always talk about the growth that they get through the academic experience, but there's also growth in the social experiences and the advocacy experiences and leadership experiences. So that's wonderful. Mira, how about your experience with student leadership with APMSA or OPMSA?
So I have a very similar experience to Madison, where I actually was a first year, my first day of orientation, watching Madison give the presentation. And I was like, I remember telling my family afterward, like, I was like, I want to be like her. Like, that's exactly who I want to be at the school. Sorry, Madison, not to embarrass you. But I just thought she was like the coolest person ever. And I was just like so impressed by everything she was saying. She came in her suit, and I was like, oh, that's who I'm going to be. So I just kind of knew from day one, honestly, from seeing Madison, I wanted to be like a guide for future students, and I wanted to help them with their transition and be a leader in that sense. And then I ended up running for the role. So I'm currently the president-elect. So we do 2 years. So president-elect and then president. So I've been really enjoying like learning from Madison. Having her as like my mentor has been really helpful, because every time we do something, I'm like, okay, next year I'm going to be doing this. And like, I need to make sure I know how to do it for then. So it's really cool, like working with someone else. And I was involved in a lot of different leadership roles in undergrad, but this has been really rewarding to be a part of a leadership that's on a smaller level at just our university, but also on a more national level with all the other schools working together for the same shared purpose.
Oh, that's fabulous. You know, Joe, we don't talk a lot about peer mentorship. We talk a lot about mentorship, but case in point right here, you know, you look up to the students that are in a class above you and want to emulate them and be successful as they are. So that's just a fabulous story. Thank you, Mira.
Yeah, and I love this story, and thank you for having the opportunity to be vulnerable with us and share those insights, because we never know how the way we show up matters to other people unless we hear it. And we don't always get that opportunity to hear those reflections. And this is that what we do matters, and how we show up in these roles does have impact. And I think it's beautiful that you just shared exactly those moments. And Jeff, this is something you and I have talked a lot about on the show, and we've interviewed a lot of different people about their mentors. And mentors don't necessarily always have to be someone older than you. They can be people younger than you. Some of our students, Jeff, I, to this day, am just like, I want to be like them. Like, they are just outstanding. And each one of you brings something special and unique that no one else has. And so learning what those things are and figuring out how you can share them with the world, this is what I think is beautiful about these leadership opportunities. You get to try these things on, you get to see other people's style and flair and pick up the things that work for you and try them on. And if they don't work and they don't serve you, that's okay, right? That's what makes you different than the way that so-and-so does it. And so just striving for your each individual's form of excellence, I commend you on that, because each of you are doing incredible work. And it's really inspiring to hear your stories. So on the idea of inspiration and shout outs, we're going to take a quick shout out from our sponsors, because without their help, we would not be able to keep the show running the way that we do. And so we very much appreciate our sponsor support. So we'll be right back.
Did you know APMA provides help with public health initiatives such as fall prevention, opioid abuse prevention, and addressing health disparities?
Did you know the APMA provides over $400,000 in scholarships annually to students pursuing podiatric medicine, helping the next generation of foot and ankle specialists?
If you're serious about this profession, if you want to grow, to lead, to make a lasting impact, join APMA today.
All right, well, thank you so much again. We're back with Dean's Chat with the Kent State APMSA, and I'd love to hear about professor shout-outs. So each one of you have had the opportunity to engage with basic science faculty, clinical faculty. We'd love to hear who do you want to recognize as someone that had a big impact on your educational experience at Kent State University. Let's see, let's go with Pooja first. I'm going to go backwards on my screen this time.
Oh, I think you put me in a tough position. Kent State just has a wonderful, wonderful list of professors. I don't even think I can name like one. I would name all of them if I could. Our professors are just so dear. I know professors that will spend countless amount of hours with you, just helping you understand resources and understand what's going on in the class and just help you pass the class and ace. And they're just amazing. I can't say enough good things about them. We'd be here forever. But someone who I recently, or not recently, but over the past year, I've just enjoyed their class, Dr. Joel Peerless. He teaches us medicine, and he's wonderful. Like, he's such a sweet person. And, yeah, that's just my favorite professor ever.
That's beautiful. And, sometimes it's the small things that have the big impact on us. It doesn't have to be, some life-changing moment. It's just those little connections. I feel this affinity for this professor that I appreciate coming to class and learning from them every day. So thank you for sharing that. Mira, how about you? Professor shout-outs.
I also, like Pooja, think that there are so many amazing ones. If I had to pick a couple, or is it one? Just one?
You could do two. We've had students do two.
So like Pooja, I'm going to have to say Dr. Peerless. He probably more than any professor that I've ever had, just like deeply, deeply cares about his students. If there's a question that like 4 people got wrong, he still puts like out of the whole class, he still puts it on the board and he's like, let's understand why we're not getting this. Like, he wants every single person to do well and get 100% on every one of his quizzes and exams, which obviously is not always possible, but he cares so much. He puts in so much time to make sure that everything that he does is catered towards what's best for the students, which is just feels really great, especially when we know he has a family and all these other obligations that he has. And I also love Dr. Petrozzi. I think he's just such a great faculty and leader. And he also is someone that really, really cares about all of us as students and wants us to understand everything that he's talking about. He always relates things back to something clinical, which I really appreciate, because I'm not maybe the most book smart person, but I really like when different clinical aspects can be pulled in, and then it's easier to visualize maybe some of those more challenging concepts. So I just think he does a really great job at teaching us.
Oh, that's wonderful. Thank you so much. Madison, how about you? Professor shoutouts.
Yeah, they both hit Peerless. So I'm like, he is just such a sweet soul. Like, yeah, I think if you ask most of the school that's had him, they would choose him. Like I said, we have like so many great professors. One that really helped me a lot and helped understand that I loved was Dr. Salome. She taught some of like the like biochemistry courses that we had. She's like a relatively newer professor and did a lot of work to like change and like listen to us and try to build like the biochemistry aspect of our education. So I love her. She scared me in class one day because there was one time they were like going over like the nervous system, and it was like part of the brain that like reacts to like when you're scared. And she was like, "Oh, I need a volunteer." She was like, "Madison, you do it." And so like I came up and I had no clue what she was gonna do. And then she was like, and then like all of a sudden she was just like, "No, run down the hall," and like screamed at me. And I froze. I didn't know what to do. And she was like, "See that's the spinal tract." And I'll never forget that. It was just funny. But another one, if I had to pick two, another one that kind of came in newer and started building a lot was Dr. Moore. He came in and listened to a lot of what we had to say, a lot of complaints, and a lot of feedback from people who've graduated. And he put in a lot of work to be able to like kind of implement more like surgical skills and get us ready for clinical aspect of like surgery and stuff. So he's very intense and he's very sometimes it's a little intimidating, but like it pushes you in ways like you don't even realize that you need. So those are my two. Yeah.
Oh, that's beautiful. And you're right. Sometimes, and that, having a professor that knows that zone of proximal development, right? If you're too comfortable, then you don't learn. But if it's too hard, you also don't learn. So where do we find that sweet spot to push you to your maximal benefit without the maximal stress? So I think that was beautiful.
I agree. And what would we do without clinical correlations? Because when you get a clinical correlation, that's when it sticks with you because you don't forget it, to your point.
Context matters so much.
Oh, it matters so much. All right. Our last segment that we like to do is rapid fire, where we just ask you a couple different fun questions. So I'll kick it off, Joe. So I'd like to ask each of you what you do to recharge your battery, right? It's super busy. You're taking exam after exam. There's a lot of stress. What do you do to relax and recharge your battery? Mira, let's start with you.
One of my favorite like day-to-day ways of recharging is through cooking. I just think it's very therapeutic in the sense that I put my AirPods in, I may be listening to a book or a podcast, and I'm just able to kind of disconnect from everything and focus in on just one task or activity. And I think I'm typically pretty good at it, so that's good. But I like to experiment with those types of different recipes. And I also really like to do yoga. So that's a great way to, I think, reconnect with something that I like to do while also being physically active. So yeah, those are kind of two of my bigger things. But after a big exam week, I would say that I really like to spend time with like family or friends doing something fun. It could be going on a trip or going out to dinner. So just being social with the people I love is definitely something that recharges my battery.
That's fantastic. Madison, what do you do to recharge your battery after a tough week of exams?
A lot of times it's listening to music and working out, just kind of like day to day. Music, I always have a speaker, I always have my headphones. It's kind of how I cope with a lot of things. But weirdly, after like a big exam week, like the most therapeutic thing to me is like, I'm going home to clean. I just love to like deep clean like my apartment and everything. Cause like when you get stressed, it gets like a little messy, but like deep cleaning my apartment while listening to music, of course, that's like therapeutic to me.
I love it. That's great. Pooja, what do you do to recharge the battery?
I love to bake. So I will bake any and everything. And I usually start baking when I get really stressed out, and then I take a break and then I bake. So and my friends love it because I bake a bunch of things, so I bring it all for them. And so they're like, "Oh, we just been stressed because she baked us cookies," and I'm like, "Yeah." But that, and then I just love like Cleveland is just such a fun city. So we have a ongoing food list, and we're like trying to be influencers. We're not really influencers, but we just have a food list, and we'll just try out all these Instagram spots, and it's just us and friends after exams, and it's a fun time.
Well, that's great. I love the Rock and Roll Hall of Fame. I've gone there a few times when I've been in Cleveland, and I didn't know what to think about the deep cleaning thing. I mean, that's pretty great to have. I mean, that's like doing things that you don't like to do, but you enjoy it. I mean, that's fabulous.
I know it's a little different, but it works for me.
It's fabulous.
You and I are friends, Madison. Never was my apartment more clean than right before an exam. It's also a form of procrastination that feels very productive. So nope, I'm right there with you. On this Instagram food, what did you call it? The food list?
Mm-hmm.
Okay, so I love food. And I think one of the best things that Instagram has ever done is show us all the amazing food that's on the planet. So I would love to hear from each of you your favorite local place to eat and what it is that you like from that restaurant. Madison, we're going to start with you, and we're going to go in with you, Pooja, so you can think about it for a little more time.
Oh, man, I actually don't go out to eat like super, super often. You might have to come back to me. I have to think about this. I don't have one right off the top of my head.
All right, that's fair. All right, Mira, we're going to jump to you.
Okay, mine is so easy. There's this thing called the Burger Box at this restaurant called Cordelia, which is downtown Cleveland, like right by Progressive Field, so where the Guardians play. And it's like, I can't even put it into words. It's like the most delicious thing I've ever eaten in my life. But it's essentially a smash burger, but very, very different and really delicious if you're ever in Cleveland.
Oh, I'll have to check that out. Now I kind of want burger for dinner. I think you guys are inspiring me for what we're going to do next. So, all right, Madison, do you need more time? It could also be like ice cream flavor. We just discovered a local like handmade ice cream place that I kind of wish I didn't know about. And they have a drive-through, Jeff, which is really dangerous because the best part about having to drive somewhere is, I've got these two kids, we got to schlep them around. No, I can just go through the drive-through. So how are you feeling, Madison? You have
I was gonna say, I was thinking, because there's like so many good restaurants. I don't have like a go-to that I'm kind of like back at every, like week by week, but one of the best ones I've been to in Cleveland is like a nice restaurant called Il Venetian. It's like Venetian, like Italian food. And so I give a shout out to there. The place is beautiful, and it was probably the best food that I've had around here.
fantastic. All right, Pooja, what's your thought about fun food places?
So there's this little area in Cleveland called Little Italy, and I'm sure every little state has a little Italy, but Cleveland's is truly, truly amazing. It's these restaurants that have been here for so long. I think the oldest restaurant is from like 1918, and somehow we accidentally stumbled into there like our first week of here. Like we didn't know anything, and we were just lost in a bunch of traffic, and we just ended up at this restaurant called Giardino's. I don't want to butcher it, but the vibe is just very cozy. It's very sweet. It's run by like an Italian family, and they're just so sweet because they just want to feed you. And they're just like, here, have a little bit of pasta and have a little bit of tiramisu and just have a cannoli. And it's just everywhere in Little Italy, it's the same. They're just these loving people who just want to feed you all these things. And I'm like, I just had like 8,000 calories, but that's okay because like I leave happy. So like you can't go wrong on that street. Like everything's great.
Oh, I love that. Yeah, food is such a wonderful love language.
Absolutely. If you don't mind, Joe, Mira, I'd like to ask you a couple questions about your social media presence and give you an opportunity. You can call it your TikTok channel and things. Were you involved in social media and a social media influencer as an undergrad, or did this all come about once you got in podiatry school? Because some of your TikTok videos I've seen, they get like 300 comments. I mean, it's pretty impressive.
Yeah, so that's funny because I have so many friends and family members, especially my siblings, who are like so beyond shocked right now. They're like, who are you? I was like the girl that would post on Instagram like maybe once a year. Like very, very rarely. maybe for someone's birthday. So this was definitely a very big change for me. And it really sparked because I was seeing so many videos on social media from different healthcare fields, and very like specific types of promotional videos or answering questions that maybe you don't want to reach out to a school about because maybe you don't want them to know that you're asking those questions, or just wanting it to be a more informal platform to ask things on, and engage with different people about things. So I was like, I don't think I've seen any videos from anyone that's in like young in podiatry or in podiatry school. And because for me, at least, I like to watch videos of like people my age or people doing similar things as me. So I thought it'd be cool if maybe like pre-med students had the ability to kind of see what their life could look like if they were to go down different paths, the way that I know there's someone on TikTok that makes a lot of great videos, and she's, I think, a fourth-year pharmacy student. So just different avenues of healthcare that you can go into. So that's really what inspired it. And then I just had to kind of swallow my pride and ego a little bit and just get over the fact that people were going to see these videos, and it was for a bigger cause. And I've been really excited just because there's been a lot of students that have reached out to me through TikTok or even Instagram. And I've had the ability to talk to tons of different students that are interested in podiatry and didn't really know where to turn or ask questions about. And it's also a really great way to kind of see what people do and don't know about podiatry. And I use a lot of those comments to kind of guide videos, because if I saw a lot of different comments just very confused about the scope of practice or how it compares to maybe an orthopedic foot and ankle surgeon. So being able to kind of bring those topics to a channel, and whether or not people see it is one thing, but just if it helps one person maybe learn something, then it feels really great.
Well, that is fabulous. And I think a lot of people see them, obviously. I was telling Joe earlier today that I started posting our videos on Reddit, and I put 4 videos on Reddit, and they've gotten like, I don't know, 11,000 views or something in the last few weeks. So I'm going to keep doing that. But you never know. You got to go where the people are, right? If they're a pre-med, you got to go where the pre-meds are when they're investigating. So my hat's off to you, Mira. Great work.
Thank you.
Joe, any last comments?
No, thank you so much, each one of you. It really is inspiring to see such engaged and excited female leaders in our profession. And I'm just thrilled to watch your careers continue to take off. If there's ever anything we can do to support you, you have our contact information. Please don't hesitate to reach out.
Thank you both so much for having us.
Well, you're so welcome. And to all of our listeners out there, whether you're on Apple or Spotify, please give us a 5-star rating, and even better, leave a comment or 2. And if you're watching on YouTube, by all means, become a subscriber. Joe and I will continue to bring not only leaders in podiatric medicine, but future leaders in podiatric medicine, like our guest today from Kent State University College of Podiatric Medicine. Joe and I are going to send each of you a Dean's Chat mug so that you can start your day the Dean's Chat way with your beverage of choice. And as Joe often says, they're big mugs, so you can use them in the morning or the evening.
So you can end your day the Dean's Chat way as well. So we have another tagline.
There you go. All right, everyone. Well, thank you again for joining us. We know how busy you are, and I anticipate that this episode will be put out in the next month or so, so we're looking forward to it. All right. Cheers, everybody. Bye-bye.
Cheers.
Bye. Thank you.
Thank you.
Bye.
Thank you.